Hi, I am Ligi Wednesday Okibuyan, a nursing student from University of Mindanao. Today, I will perform the urinary catheterization. The definition of it is the introduction of urine catheter through the urethra into the bladder for instillation and removal of fluids. The purposes of it is to relieve urinary retention and to obtain sterile urine and also to provide access for instilling medication into bladder and to maintain empty bladder during surgery, and lastly is to monitor an early urine in ill client. And now let's perform the urinary catheterization. For male client, first thing to do is check the doctor's order, and you can only perform catheterization if it is in the medical order. Next is assist the client for allergic on iodine and plaster, because in catheterization, you will use iodine for cleansing the vulva. Assemble all equipment needed to promote time management. And next is identify the client and explain the procedure. The rationale for this is to ensure that you have the right client and to elicit cooperation. Good morning, ma'am. I am Ligi Wednesday Okibuyan, your student nurse for today. And by the way, yung sa name mo, ma'am? Okay, Marites. Pwede na to i-check ang wristband. Today, ma'am, is mag-perform ta og urinary catheterization. Na ba kayo mga allergic, ma'am, sa iodine? Next is provide good lighting. Good lighting is necessary to locate the meatus clearly. Provide privacy by screening and closing the doors or windows. And the client has the right to be protected from exposing to others. Place a waterproof underpad under the client. This protects the bed linen from moisture and getting soiled. Place a client into supine position with feet apart and drape the client to have a good visualization of the meatus. Observe aseptic technique, sterile technique, protect the client and prevent the spread of microorganisms. Imagine that this is a sterile OS and this is a sterile field. Squeeze a small amount of lubricant over the sterile OS placed in the sterile field. Using sterile pickup forceps, get 2 cotton balls with betadine antiseptic solution from the sterile jar and place on the sterile field. Wash hands and put on the working gloves. The rationale of this is to prevent the spread of microorganisms. Don't forget to put the fenestrated or eye drape to prevent the accidental contamination of other areas. Then hold the penis with a non-dominant hand. Disinfect the meatus twice using cotton balls with betadine solution. Lubricate 6 to 8 inches of catheter tip. Hold penis perpendicular to the body and pull up gently. And hold the catheter in the dominant hand steadily and insert the catheter about 8 inches. And do not force the catheter through the urethra. Then, ask the client to breathe deeply and rotate the catheter gently if slightly resistant meat. Ma'am, ginhawa ng tamam ha. We are using a Foley catheter. Must be introduced the 5 cc distilled water. Gently pull the catheter until retention balloon is snuggled. And this is the sign that resistance is met. Tape the catheter in lower abdominal area. And do not put it under the legs to prevent backflow of urine. And don't forget to remove the fenestrated eye drape. Now let's do the aftercare. Remove and clean the equipment. Make client comfortable. Label the urine specimen and report to laboratory promptly. And And lastly, record the time of catheterization and the amount of urine, and also the description of urine and the reaction of the client during the procedure and other observation. A careful record is important for documenting the data for the client's care. The recording and reporting of the information must be accurate and timely for the continuity of care. This time is female catheterization. Same as a male catheterization, identify the client, check the doctor's order, wash hands, don gloves, explain the procedure, same. And now let's proceed to the inserting of catheterization. Same as the procedure earlier, put a fenestrated or eye drape to the client to prevent accidental contamination and to provide a sterile. Place a fenestrated drape over the vulva and expose only the labia. Lubricate 1 to 2 inches of catheter tip. The thumb and foreign finger of your non-dominant hand, spread the labia and identify the urinary meatus and maintain a hold until catheter has been inserted. With the dominant hand, disinfect the urinary meatus using cotton balls with betadine. Insert the tip of catheter into the dimple-like structure below the clitoris. Then remove the fenestrated drape. Next to it is place a client to a comfortable position and do the aftercare. Then next is to remove the gloves and wash hands. Label the urine specimen and report to laboratory promptly. And then lastly is documenting the following date and time of the procedure and output of urine, observation of the client, and his reaction. A careful record is important for documenting the data for the client's care. Recording and reporting of the information must be accurate and timely for the continuity of care. This time is removing of indwelling catheter. First thing to do is check the client's chart. Removing an urinary catheter is done only if it is in medical order. Obtain a 5 to 10 cc range depending on the size of the balloon of the catheter. Second is identify the client. With the ticket, call out the name of the client, then check the wristband and also explain the procedure. Then inform the client that there was a slight discomfort in removing of catheter. Withdraw all the water or solution from the balloon. Then place a absorbent towel and a mattress under the catheter. Then tell the client to take a deep breath. Ma'am, ginawa ta ma'am. 1, 2, 3. Then pull the catheter. After removing the catheter, inspect if it is intact, and if it is not, notify the physician immediately. Measure the output in the drainage bag and record the output on the input and output sheet. Empty the urine into the toilet bowl and dispose the urine bag into the yellow bin. Next is remove gloves, wash hands, and make client comfortable. Then instruct the client that drink extra fluid. Then warn the client that there was a mild burning sensation during the first void. Lastly is document the time on removal of catheter. A careful record is important for documenting the data for the client's care.